Hello everyone, and I'm really very excited to be with Dr. Shagun. She has achieved the amazing rank 13 in the INI-CET examination. So, heartiest congratulations, Shagun, first of all.
Thank you so much, ma'am.
So, I think, Shagun, you are DBMCI TND student.
Yes, sir. Yes, ma'am.
So, what is your feeling?
I'm feeling really happy. It feels like all of my hard work has finally paid off.
Yeah, really. And you have made us also proud. So, Shagun, tell us something about your journey with DBMCI. How was your TNT?
Yeah. Ma'am, my journey with DBMCI actually began much earlier in second year. I won the subscription in a quiz. So at that time, classes had mostly ended, so I got access to the study material, which I found quite useful. And in my final year, I had access to the eGurukul app during the COVID lockdown. So I made notes for a couple of subjects like surgery and medicine. And in internship, I used the TND. So with the I really liked the ophtha TND, the radio TND, surgery TND, medicine TND, and anatomy TND. These were the best in my opinion, and they really helped me in my journey. And I also gave a lot of grant tests with DBMCI, in many of which I secured a top position. So I was also added to the Super 30 group of DBMCI.
Yeah, Shagun. So, because some people do not know about the quiz, can you elaborate? You won the quiz.
Yes, ma'am. There actually, eGurukul has been sponsoring a lot of quizzes in. I am from MAMC, so eGurukul has been sponsoring a lot of quizzes in our college as well, and even in their grant tests also. So those were the main areas where I got in touch with eGurukul and DBMCI.
Okay. So, how did you felt about the schedule of this TND?
Yes, ma'am. I feel the just a second. Hello. Yeah, ma'am. The TND was very well structured. It began in January last year.
Your volume is slightly low, Shagun. Can we increase the volume?
Yeah. Am I audible, ma'am?
Yeah, but it's slightly low. If we can increase the volume.
Just a... Hello.
Yeah.
Am I audible, ma'am?
Yeah. You can
Actually, my settings are all right, I think.
go to mute and then again unmute. I think reset the settings once.
Should I rejoin the meeting, ma'am?
Yeah, you can do it because yeah.
Hello, am I audible now?
Yeah. Now it's perfect. Yes.
Okay, ma'am.
So you were saying something.
Yeah, ma'am, the TND, it started in January last year, and it was structured. It used to happen every week, and so during the week, I used to study for the subject, and then I used to give the TND. I used to make notes of the discussion. Whichever discussion I was able to attend live, I used to attend live. Otherwise, if I was not able to, then I used to watch the recorded version. And there was another cycle of TND which happened after September. So if there was any TND which I was not able to attend, I attended in the second cycle.
Okay. So how did you felt the tests were like? Means what was the plus and if there is any minus about that?
Yeah. Ma'am, I gave the grant test. So the questions were of good quality. The only thing that I feel could be improved if the explanations could be given in a video form. Like the explanations were in the test only when we got the result. So if the explanations could be given
I
subject.
think we are giving the video explanations of the GTs. Shagun.
Ma'am, the test that I gave at that time, there was, maybe it would have started now. At that I gave around last year, in the beginning of last year. At that time, the test only had the discussions in the result only. So that was one thing. So that is why after a point I slightly decreased giving the GTs over here. So that
Acha,
was,
you said that the questions were good. So, what is your definition of good? How did you feel that the questions are good?
they were not completely straightforward. Like there were some clinical questions, long stem questions, and there were questions that made you think what the answer could be. So they weren't completely
You,
easy. They
you
were,
mean to say they were clinical?
yes, ma'am.
So, do you think that the clinical questions, the practice of these questions are important for your exam?
Yes, ma'am, because every year the pattern was, this time it was slightly atypical, but the paper usually has been tending towards the clinical side.
Yeah, I think that is the peculiarity of INI-CET. Every time they give you some, typical things. But apart from that, I think it was a balanced paper, and the weightage of the subjects was also pretty fine distributed. So, do you feel that the kind of questions that you attempted in your TNDs or maybe SWTs or rent test, they helped you in actually doing the final paper, give you a kick kind of practice of these questions?
Yes, ma'am, definitely. The TNDs were especially very useful because there were subjects that like radio, in which I just read the TND and it gave me a very comprehensive view of the entire subject in a very short time. So I was able to revise in the end using just the TNDs. And a couple of questions were repeated as well from the TNDs itself.
Because Bhatia's we are known for our tests. So you even in my times also we used to say कि Bhatia नहीं दिया तो कुछ नहीं दिया. Bhatia tests are famous from that time, and actually I think they deserve it. We like the kind of the quality of questions and everything that they are doing. So how much important do you think that giving test is? Like you do the theory, but giving test is how much important before the final examinations?
Giving tests is very important because your knowledge is of no use if you cannot apply it in the real
Exactly.
scenario.
Hmm.
So you need to know how to understand the question and how to eliminate options and how to come to the correct option. So even if you have the knowledge about a particular topic, it's not the same as being able to solve questions for that topic.
Yeah. So that means practice means a lot.
Yes, ma'am.
Yeah. Okay. So do you feel that your queries were being answered, Shagun? How was the Delhi staff? They were cooperative, everything.
Yes, ma'am. Especially Dr. Ashish, he has been very sorry, Mr. Ashish, he has been very helpful from the very start. He has coordinated with me as well as other batchmates of mine from MAMC. Any grievance we had, any problem we had, he has always addressed it. And even the other support staff was very helpful as well. But I would like to give a special mention to Mr. Ashish.
Oh, yeah, because Delhi Center ma'am takes a very personal care, very motherly affection for this Delhi Center, and she makes sure that everything is fulfilled. So your queries were solved every time. You said that if you missed one TND, that were you given the information that this TND you can attempt at any other place?
Yes, ma'am. I used to get regular messages for where the TND is being held, so that was not an issue. And even Anu ma'am, she used to personally message me to ask how my preparation is going and used to give me blessings. It really meant a lot to me.
Yeah. So how will you score it out of 10?
Score the entire experience with eGurukul. I would give
Entire experience with the eGurukul test with the entire DBMCI. How
I
was
would
your experience?
give it 9 out of 10.
Oh, so it's a really good one. So, any other thing, any piece of advice that you learned, and you would like to say anything about tests, because most of the students are actually, they are not sometimes, afraid of giving tests. So you can enlighten their path that is there anything to get scared, or we should give frequently the test?
Being scared of tests is never the solution. It's you need to face your fears, and even just not just the SWTs or the TNDs, you need to give GTs also early in your preparation. Fear is not going to land you anywhere. If you take that fear to the real exam, then it's not going to work out. You need to fight that fear. ज़्यादा से ज़्यादा क्या होगा? You won't get a good rank, but then you have something to work on. You will get to know what your weaknesses are, what your strengths are. So the test is not for your rank or your marks. The test is for your analysis, for your preparation.
All right. So, Shagun, were the GTs containing all type of questions that are actually expected in the exams?
Yes, ma'am. Most of the GTs were actually they were mostly NEET pattern. INI-CET pattern GTs, I don't think I gave any. Mostly were NEET pattern, so they correlated with what kind of
You
questions.
gave the mock. We had given before the INI-CET, we give the INI-CET pattern question paper also.
I didn't take that.
Okay.
But the tests I gave, which questions were very similar from what I had seen have been asked in the previous few years. So that was good. But INI-CET in general, nobody can actually predict what happens in that exam.
Yeah, yeah. So actually, the topics are same, but yes, type of asking, the type of question may be changed. So was the GTs enough? It was giving you a good comprehensive practice of all the type of questions.
For sure. The GTs of DBMCI were the GTs that I initially started from. Like, I started giving the GTs in my at the end of my third year only. In my final year, also I gave them. So I started early with that. So at that time, those were the GTs that actually helped me get the hang of it. So I'm very grateful.
So how frequently you will advise your colleagues or juniors to give the test?
Ma'am, it depends on when you're starting actually, but ideally the last critical point when you should be starting is about 3 to 4 months before the exam. Like that is the last point. Usse pehle you can start 1 year, 2 years ago. So you should have one baseline. So if you are starting an internship or 1 year ago, so you give one baseline exam, no matter how much you've studied, no matter how much you've prepared, you will have your baseline. And then after that, you can give it, say, 1.5 or 2 months later. And then gradually you keep increasing the frequency to, say, once in 1 month and once in 2 weeks. But don't give it too frequently. Giving too frequently is also hazardous because it takes a lot of time to give the GT, to analyze the GT. So it's exhausting. So don't
Okay.
give it to more than once per week.
So more means one per week is the optimum one, you mean to say? We can give that.
Close to the
Okay. So any other piece of advice, Shagun, that you would like to give? Because every journey is unique. So everyone gets to learn something. What is your experience and what you would like to say?
Um, I would just like to tell everybody that there is nothing to be scared of. It is just an exam. You've done MBBS. You can crack this exam as well, and you need to believe in yourself. Nothing is impossible.
All right. So thank you so much, Shagun, and heartiest congratulations once again. You have made us, DBMCI, very, very proud, and we wish you all the very best for your future endeavors too.
Thank you, ma'am. Thank you so much.
Thank you. God bless.